The purpose of this presentation is to help you a little bit or give you some assistance with your assignment this week. The assignment this week is actually to step through the process of the 5 A's when it comes to framing what your evidence-based practice is going to be. So think about the assignment as looking the steps that you should work through on the assignment is looking at a specific population, um, and then determining what intervention might work best for that population, and then presenting your thought process in going through these 5 A's. One of the most difficult skills is actually knowing how to apply evidence-based practice within your setting or within public health as a nurse. We're going to do this by actually stepping through the 5 A's and working through an assignment with it so you can better understand the concept. When it's time to explore the scientific literature for what the best practice evidence might be for the specific intervention or the health problem that you're looking at, it is actually very helpful to first make sure that you identify what the question is that you are going to focus your search on. One helpful way to frame a question is actually using the Pitcott approach, which you guys should be familiar with. The Pitcott approach is P, patient population, I, intervention of interest, C, comparison intervention of interest, O, outcome of interest, and T, which is the time that it takes to implement. I will say that T might not be necessary to include when we're looking at a literature review, but it actually can be helpful to include when we plan how and when we are going to evaluate the population for health outcomes. When we're working on ASK, we may want to consider working with other public health nurses or community partners to identify what the issue is or what the specific health concern is, or with a specific population. We need to try to determine if there's a gap in service that needs to be addressed. We might work with other public health nurses or community partners to actually create a specific practice questions. And we also can identify reasonable client outcomes that we wish to achieve with modified or new best practice evidence. These are all the things that we need to think about when we're on the ask. Next, we are going to acquire. We are going to search for the answer by exploring all different levels of evidence. The levels of evidence that we actually talked about in the last slide deck, so please review that if you need help with that. After we write our question, we need to work on identifying what the keywords are in the sentence. Usually, the keywords that we want to pick out are the P, the C, and the O, the patient population, the comparison intervention of interest, and then also the outcome. These keywords are used when we go to look up in databases or in the library when we're looking for the evidence to support us. So things that we can do or think about when we're working through Acquire are working with our librarian or community partners to identify credible data sources using all 5 levels of evidence. Identify appropriate databases to search for keywords. We can conduct informant interviews. We can also conduct searches, literature reviews and literature searches. We want to stick within the last 5 years when we do this. Next, what we do is we appraise, which when we're doing this, we compare and contrast the different interventions, studies, or reports that we've come across. We select the best ones with the most credible evidence that fit the question that we're looking at and the clinical outcome that we're looking for. So it needs to address your specific question. So when we're working on this appraise portion, we need to think about how you would present findings or recommendations to public health nurses and teams that you're working with. When we're doing the appraise, we need to critically evaluate the evidence and select what the best practice would be. You can do this by working with others, work with community partners and consult practice experts, or work with key community stakeholders and determine population preferences and values. Once we've gone through asking the question, acquiring the information, and then appraising the information or the practices that we found within the literature, we're going to want to apply it or to make it actionable. We do this by using the evidence to change practice. We're going to want to report when we do the application, we're going to want to take any of the credible evidence that we've had from the appraise step and report it to community partners. This provides the support for us using an intervention. We also want to make any recommendations to change in practice or tell people about the new intervention. We want to collaborate with community partners on modifications or current interventions. We also, at this point, at the application process, we want to think about how we will evaluate the effectiveness of the change and the outcome that we would like to achieve. The final A is assess. And what this does is it gives us an opportunity to actually evaluate if the intervention worked and if health outcomes of a community have improved once we implemented our evidence-based practice. Prior to that evaluation taking place, we actually need to determine how and when the outcomes will be evaluated and how we're going to measure their effectiveness. When we're doing this, and when we're looking at assessing a intervention, we're going to want to consider both the effectiveness of the interventions, but also the efficiency. So how much time and resources did it take to implement this intervention? And it's really doing a cost-benefit analysis. And what I mean by this is if the cost of implementing an intervention were $3 million and it took 500 people and it only improved 2 people's health outcomes, that is not a very cost-effective intervention, and it's likely that we need to figure out another intervention from a sustainability purpose and from an outcomes purpose in order to implement to improve health outcomes. In this presentation, we went over the 5 A's and tried to give you a little bit more information that might help with your assignment. In this particular assignment, what we are looking for is that you use literature to find interventions that could be used potentially for a population of interest to improve health outcomes. So we want you to ask a question about and find a population and find a health outcome that might need an intervention in order to improve upon the health outcome. And once we do that and we ask the question, we want you to then go to do a literature review where you find some different interventions. And then the next step is to appraise those interventions. So you're going to tell us what intervention might work best and tell us why. It may be because the intervention was the top level of evidence. It may be because it it has been found to work with the specific population that you are considering. We don't want you to actually apply the intervention. When we talk about apply, we want to know if it's been applied in other populations here. And we want you to consider how it could be applied within your population. And when we go to the assess, because we're not going to have an outcome to assess, we want you to just consider what you might look at in terms of an assessment and evaluation to determine if the intervention did improve health outcomes.